I was the very first member of Congress to introduce the full-scale repeal of Obamacare. And I want to make a promise to everyone watching tonight. As President of the United States, I will not rest until I repeal Obamacare. It's a promise. Take it to the bank, cash the check. I'll make sure that that happens.
Governor Romney, just yesterday, Governor Pawlenty, who is to your left on the stage tonight, called your Massachusetts plan, which you know has become a focal point of the criticism in this campaign from your friends here, Obamacare. Obamacare. Is that a fair comparison?
You know, let me say a couple things. First, if I'm elected president, I will repeal Obamacare, just as Michelle indicated. And also, on my first day in office, if I'm lucky enough to have that office, I will grant a waiver to all 50 states from Obamacare. Now, there's some similarities and there's some big differences. Obamacare spends $1 trillion. If it were perfect, and it's not perfect, it's terrible, we can't afford more federal spending. Secondly, it raises $500 billion in taxes. We didn't raise taxes in Massachusetts. Third, Obamacare takes $500 billion out of Medicare and funds Obamacare. We, of course, didn't do that. And finally, ours was a state plan, a state solution, and if people don't like it in our state, they can change it. That's the nature of why states are the right place for this type of responsibility. And that's why I introduced a plan to repeal Obamacare and replace it with a state-centric program.
Governor, you just heard the governor rebut your characterization, Obamacare. Why?
Let me first say to Sylvia, she has put her finger on one of the most important issues facing the country, which is President Obama stood before the nation in 2008 and said he promised to do health care reform focused on cost containment, along with Republicans. He'd do it on a bipartisan basis.
The question, Governor, was why Obamacare?
That's right. Well, I'm going to get to that, John.
You have 30 seconds, Governor.
Yeah, so this is another example of him breaking his promise, and he has to be held accountable. And in order to prosecute the case against President Obama, you have to be able to show that you've got a better plan and a different plan. We took a different approach in Minnesota. We didn't use top-down government mandates and individual requirements from government. We created market alternatives and empowered consumers. I think that's the way to fix health care in the United States of America.
And you don't want to address why you called Governor Romney's Obamacare?
Well, the issue that was raised in a question from a reporter was, what are the similarities between the two? And I just cited President Obama's own words that he looked to Massachusetts as a blueprint or a guide when he designed Obamacare.
But you chose, you say you asked a question, which is fair enough, but you chose those words. And so one of my questions is, why would you choose those words, maybe in the comfort of a Sunday show studio? Your rival is standing right there. If it was Obamacare on Fox News Sunday, why is it not Obamacare standing here with the governor right there?
President Obama is the person who I quoted in saying he looked to Massachusetts for designing his program. He's the one who said it's a blueprint in that he merged the two programs. And so using the term Obamacare was a reflection of the president's comments that he designed Obamacare on the Massachusetts health care plan.
Governor, you want to respond to that at all?
No, just to say this, which is, my guess is the president is going to eat those words and wish he hadn't put them out there. And I can't wait to debate him and say, Mr. President, if in fact you did look at what we did in Massachusetts, why didn't you give me a call and ask what worked and what didn't? And I would have told you, Mr. President, that what you're doing will not work. It's a huge power grab by the federal government. It's going to be massively expensive, raising taxes, cutting Medicare. It's wrong for America. And that's why there's an outpouring across the nation to say no to Obamacare. And I'm delighted to be able to debate him on that.
No, Mr. Speaker, you have, I'll let you, Mr. Speaker, you have at times said, you know, maybe you do have to consider a mandate. You've been very open to the individual mandate. It has become, it seems, at least at the moment, a litmus test in this Republican primary. Should it be?
Yes, it should be. If you explore the mandate, which even the Heritage Foundation at one time looked at, the fact is when you get into a mandate, it ultimately ends up with unconstitutional powers. It allows the government to define virtually everything, and if you can do it for health care, you can do it for everything in your life, and therefore we should not have a mandate.